Hi, welcome to our Facebook Live event on exercise injuries, tips for prevention and recovery. My name is Dr. Jennifer Gordine, and I am a primary care sports medicine physician at our Kaiser location in Silver Spring, Maryland. We have an amazing sports medicine program that consists of primary care, orthopedic surgeons, physical therapists, and rehab specialists who are highly trained to help athletes recover from sports-related injuries and return to play. But don't worry, if you're not a high-level athlete, if you don't participate in college or high school sports, and you're just someone who's interested in exercise and becoming more physically fit, hopefully today we also have some tips and helpful resources to share with you to help you become more active and avoid potential injury. Today, I'm joined by two of my amazing colleagues and friends, Dr. Sisson and Dr. Tassi. Dr. Tassi, would you like to introduce yourself?
Hold on one second. Hi, Dr. Gordine. Thank you for having me on this panel. Very happy to be here. My name is Leonard Tassi. I'm one of the orthopedic surgeons with Kaiser Permanente. I'm usually in the Kensington location. I've been with Kaiser Permanente for about 19 years. After I finished my residency, I did a fellowship in sports medicine, and I treat a lot of sports-related injuries, both those that require surgery and those that don't. So I'm happy to be here, happy to have this talk with the panel.
Thank you, Dr. Tassi. Dr. Sisson, please introduce yourself.
Thanks for having me. I'm excited to join Dr. Gordine and Dr. Tassi here. My name is Rich Sisson. I am a doctor who's certified in family medicine and primary care sports medicine. I work primarily in the Northern Virginia region here at Kaiser Permanente, and I enjoy taking care of athletes of all ages, both staying healthy and then helping them recover from injuries that they have and getting back to the sports and activities that they like to do. I think exercise and physical activity is important for general health and to keep you healthy and happy. And I like to get outside walking and hiking and anything I can do outside when I can. But thanks again for having me. This will be fun.
Thank you to you both. And thank you to our audience for joining us today. If you are joining live, we want to hear your questions and we want to hear from you. Please feel free to type your questions in the comment section. All right, guys. Well, I think maybe we should get the conversation started off by talking about overuse injuries. Dr. Sisson, do you want to share with our audience essentially what overuse injuries are and what we mean when we say an overuse type injury?
Sure. Thanks, Dr. Gordine. So when we talk about overuse injuries, you can think about hurting yourself all at once, which would be like an acute injury. If you fall down off the roof, you break your wrist. That happened in one afternoon. Overuse injuries are things that happen when you continuously load your body or joints or other structures less than like a maximum amount over time. So submaximal loading of your joints and bones over time can cause repetitive or overuse injuries. The injuries can happen at different parts of the body. So in our musculoskeletal system, they can happen with your muscles, your tendons, the bones. Old people like me can get sore joints that are sore and achy. And younger people who are still growing, like kids, have open growth plates that we call physes. And so kids can get overuse injuries at their growth plates or at any of the other places. And these overuse injuries often happen when you just don't give your body enough time to recover from repetitive activity, don't give it enough time to heal. So one or another of these places along the chain kind of gets angry and breaks down and gets sore, achy, or has problems.
Thank you, Dr. Sisson. I think, key words that you mentioned towards the end is just, recovery and giving your body time to heal, especially I think that's really important when you're training and when you're getting involved in exercise or sport. Could you share with our audience maybe what are some of the common causes of overuse injuries, Dr. Sisson?
Yeah, when we think about overuse injuries in general, I mean, it's in the title. So you're using something too much. As you said too, part of it is not giving your body or your system a chance to rest or recover from activity. And so if you think about the people that have overuse injuries, oftentimes, if you look at a textbook, the people that are at risk for having more overuse injuries, one of the groups is people who've had overuse injuries before. So if you have a history of pushing too hard or had injuries in the past, it's more likely to happen again. Another thing that makes sense is like higher training volume. So if you're doing more activity, more mileage or more minutes a week than you're used to doing. So if you increase your activity or volume, you're more likely to have an overuse injury. Specifically in kids, there's times that with a growing skeleton and bones and growth plates, that kids are probably more likely to have overuse injuries at periods of like rapid growth. So if you think about like an adolescent or an early teenager who's growing a lot, or that kid that you know that shot up like 4 inches over a year, those are times when all these structures might be more susceptible to getting injured. Maybe another general person. So if you think one other group that you think might be more likely to have overuse or stress injuries, specifically in our female population, adolescents or adults, women, if you end up missing your menstrual cycle, it's probably an indicator that you don't have enough energy to support the activities that you're doing, and that can put a stress on your body. So in women, a risk factor for overuse injuries, if you notice changes in your overall health or missing your menstrual cycle, can make you more likely to have a bone or a stress injury that occurs.
Thank you, Dr. Sisson. I think I 100% agree with everything that you just shared. Very commonly in my sports medicine practice at Silver Spring, I see a lot of young people going through growth spurts and experiencing some overuse injuries. And so I think it's important for parents to kind of be aware that during that growth period, that growth spurt period, that overuse injuries are very common, and they should be on the lookout for those, especially if their child is involved in sports. Dr. Tassi, could you maybe share with our audience what some common overuse injuries are that affect the upper extremity, meaning our arms and shoulders?
Sure, happy to share with you on that, Dr. Gordine. You're going to see this especially more at this time of year when some kids are getting off a slow summer, and then they're trying to accelerate into sports, and they're doing too much too quickly. So this is the fall is the time that we see a lot of these injuries. Two of the more common ones that we see in the upper extremity are called little leaguer's shoulder and little leaguer's elbow. And these are kind of related to what you were talking about with growth plates, because the kids are still growing. So a lot of the growth of the shoulder or of the humerus comes from the shoulder, right in the shoulder area, the top of the humeral bone. So for people who are doing a lot of throwing activities, you'll see something called a little leaguer's shoulder. And it's actually a disturbance of the growth plate of the upper arm, and it can lead to a lot of pain and discomfort, and it's honestly related to stress at the growth plate. This usually will require several months of rest and time off from their throwing activity. Usually you'll see this in baseball pitchers, but you can also see it in other throwing athletes, and some things that have been linked to this have been throwing breaking balls, or pitching too long or too many innings or too many games a week. And a lot of times you have to really be in contact with the parents and the coaches so they have an idea of how much or how little they should be pitching to try to alleviate these things. The second one is called little leaguer's elbow, and it's it has kind of some similarities to it. The inside part of your elbow gets very stressed during certain phases of pitching or throwing activity. And this can affect the muscles, the bones, and the ligaments. The ligaments are what hold the bones together. So the whole inside part of the elbow can be affected by this. And again, it's usually with overuse, too many pitches at one time, too many innings, not really paying attention to a pitch count. And sometimes these can have long-lasting effects if they're not recognized and addressed before there's any structural damage before any structural damage has occurred. So there, two things really need to take quite seriously.
Can I say one thing too? So
Yeah.
you said it, but it's kind of in the name, which is both of these have little leaguers, and it kind of goes
Yeah.
with that thing that oftentimes people are like, yeah, 10, 11, 12, 13. So like little league, if you ever play baseball, like ends at 12 years old, roughly.
Mhm.
Like the Little League World Series is going on. They're like all 12-year-olds. So like that's like the age range. These are the kids that like around that age have these overuse injuries, and that's when you see it too. So just thinking about that kind of age range for these growth plate injuries.
Yeah, and you also mentioned pitch count. I think it's really important for parents to understand and know what that means in regards to if you have a child who participates in throwing sports. They should be limited in terms of the number of throws that they do per game and per week. And this is brought about to hopefully prevent them from developing these overuse type injuries. So
Dr. Gordine, when you see people in your clinic, do you think that parents and kids generally who are like playing, I mean, baseball is one of the more throwing things with repetitive throwing. Do you think parents, for the most part, understand about pitch counts, coaches? Do you see that most people are educated about it? I think that's changed probably over the last 10 or 15 years that people seem like they're more aware about it now.
yeah, I definitely think parents and coaches seem to be more aware about it. Are they following it as best that they should? Maybe not all the time. I think, when it comes to youth and competitive sports, sometimes, our judgment can get clouded by, just wanting to compete and wanting to reach a high level. And, these young kids might have aspirations to play their sport in college or, professionally eventually. And so, they're, a lot of times driven by just wanting to, throw and throw as fast and as much and as, get as much practice in as they can. And so just cautioning them and just reminding them that, hey, I understand the goal is to perform at a high level, but you're not going to be able to reach that goal, or you're not going to be able to sustain the level of high level of activity you want to reach if you don't limit yourself in terms of how much you're throwing when you're growing, especially.
I have a son who's actually in Little League, and I've had a little inside information on this. And most of the coaches are somewhat educated about pitch counts. They don't necessarily always listen to it, but they are educated about it. So it's important, really, the parents and the child and the coach to have some idea of what's going on. And then in that 11 to 12 age range, it's usually not supposed to be more than 65, 70 pitches and at a time or per game, and not more than 2 games per week. But it really is important to pay attention to that. As you get older, the pitch count goes up a little bit. As you get younger, it goes down. But it is important, the coaches, parents, and kids, that they're all on or at least the coaches and the parents are all on the same page. It is really important.
Dr. Tassi, too, you told me before when we were talking about this that especially year round, because kids get into sports and they do them year round, you're telling me also that you recommend people that do year-round sports maybe take a break somehow so that you're not doing the same motion or same activity year-round. What do you tell parents about, like, is it okay to play baseball 12 months in a row? All these people that have travel teams, do you have insight on that?
Yeah, that's a difficult conversation sometimes to have with parents, but it really is important. Some of the kids and the parents are so motivated to play sports and improve, and they're looking at scholarships, and they go to showcase events or tournaments to get more exposure, and they may play 2 to 3 games per day, and that really becomes dangerous at some point. So it really is important to not play more than 1 game at a time. And I try to tell parents not to have them on a school team and a travel team at the same time, but not everybody always listens. And but and those people who are playing multiple games per day, those are the ones who have put themselves at higher risk, let's say. So yeah, it's an important conversation to have, but it's sometimes difficult to make it stick, I would say.
Yeah.
Yeah, I definitely agree. 100%.
Yeah.
Dr. Tessie, what about some overuse injuries that affect the lower extremity? What are some common ones that you normally see in your practice?
Well, very good question too. I would say that this time of year, with kids returning to sports, one of the most common lower extremity ones would be stress fractures, and that can affect quite a few bones in the lower extremities. The most common one we probably see are tibial stress fractures, and this is an overuse injury where the bone is taking more stress than it's used to, and you get what are called micro fractures or micro cracks. And if it's not appreciated and treated, it can turn into a complete break. And that's when casting or surgery sometimes become necessary. So you want to try to pick these up earlier, and especially with kids returning as like track athletes. Like right now is cross country season, so we're seeing that quite frequently. One of the more concerning stress fractures involves stress fractures around the hip, and these happen as well. And a stress fracture in a hip that's not recognized can actually have a devastating outcome, where if it's not recognized and the hip goes on from just a stress fracture to a complete fracture and it has to be treated surgically, you may wind up with a young kid who's going to have arthritis in their hip in their 20s, and they're not going to be able to perform as well as they want. So it's really something to be very careful about. I did have a patient with something like that last year. It was very concerning. Two of the other ones I would say that we see a lot in the lower extremity, most common one that I'm sure all of you guys have seen too, would be Osgood Slatters disease. And what that is, where your patella tendon inserts on the top of your tibia, which is called your tibial tubercle. A lot of times with repetitive running or stress on the patella tendon, it will kind of pull on the insertion on the tibial tubercle, because that's not completely fused to the bone yet, because kids are still growing. And that can cause a lot of anterior knee pain. It can cause swelling. It can cause a bump that looks kind of like a little tiny knot, like a grape on the front of the tibia. And parents and kids really get worried because of how it looks. But generally, this will go away with either rest or by the time the kids reach skeletal maturity. But that is one probably that we see all year round. But I would say it's most likely the most common one. Some less common ones would be what's called Sievers disease, which is, hold on one second. Hold on. Sorry, cut out there for a second. Am I still here?
Yeah, you're still here.
Okay.
We're still with us.
It's like I got beamed away for a second. I don't know what happened. So sorry about that.
No problem.
But the less common one's called Sievers disease, which affects the heel, and a lot of it is from the Achilles tendon pulling on the heel. That we don't see as frequently. And then one that has more likelihood of requiring surgery would be a sports hernia, which is where there's a strain of the abdominal wall musculature and also the muscles on the inside part of the thigh, which are called your adductor muscles. Those are kind of less commonly seen, but the stress fractures are the ones that sometimes honestly worry us. Okay.
Yeah, I think, maybe for our audience, they may be familiar with terms like shin splints or runner's knees. These are kind of some of the terms that we can also use to describe some of those injuries that you were just mentioning.
Yeah, some people call it runner's knee, some people will call it jumper's knee, but yeah, definitely that would be the more common term, or a shin splint. The shin splint is kind of like the beginning of a stress fracture. It's like on the early spectrum, and then it's also called a stress reaction. But yeah, a shin splint is a good way to refer to it.
Yeah, and that's kind of like your, I like to tell my patients, like your warning sign, like, hey, this is your body telling you need to, maybe take a step back, rest, and allow your body to recover so that you don't end up with, something like a tibial stress fracture that's going to take you
Sure.
out of your sport for an even longer length of time.
Definitely.
Dr. Gordine, so with your sports medicine clinic, just like Dr. Tassi said, cross country, it's starting up right now. It actually really started like, it didn't stop. The kids have been running over the summer. They ramp up during the summer. Now they're back in school. But cross country is probably the ones that we see these stress injuries or lower extremity kind of overuse injuries. If somebody's running cross country and they've got sore shins or lower legs, what do you tell them when they come to see you? What kind of tests do you do, or how do you try to figure it out when you see them? How do you counsel people like a new cross country runner that comes in with leg pain? What do you do when you see them in the office?
Yeah, so I definitely try to share with them some tips to hopefully prevent them from developing something like an overuse injury. And the main highlights or the main tips that I like to share are, make sure that you're using proper technique and you're using the proper gear. So if you're a runner, it would be, making sure that you have proper running shoes and that you're changing those running shoes every 250 to 500 miles. One of our colleagues, Dr. Schwartz, who's a podiatrist, he had a really good video on our Kaiser blog that hopefully we can share the link with our audience that kind of shows you some of the things to look for in the store when you're shopping for running shoes. Because I get this question all the time, what brand of running shoes should I get? And it's not necessarily the brand, but more so some of the characteristics of the running shoe. So hopefully, like I said, we'll share that link for our audience. So again, having proper technique, proper gear. Also, I tell my patients, make sure that you pace yourself, especially when you're getting started with a new workout routine. You don't want to do too much too fast too soon. You want to gradually progress your level of activity. And that means gradual progression in terms of intensity, how long you're working out or how long you're running, and the distance in which you're running, or the amount of weight that you're lifting. I think a good rule of thumb is you never want to increase your activity level more than 10% each week when it comes to running or lifting weights or whatever you are choosing to do. So pacing yourself is important. Also, cross training or adding some variety to your workout is also really important. That way, you're using or you're working out different muscle groups so that you are less likely to overuse one particular muscle group and result in an overuse type injury. And so great cross training activities could be, walking, like jogging, low impact cardio, also doing some strength training, and doing some flexibility things like yoga. I think is a great tool to keep in mind when you're training. And then lastly, rest and recovery. I mean, we kind of highlighted this a little bit earlier in our conversation, but it is important to incorporate rest days in your workout routine and allow your body time to recover. It's important. You can't work out 7 days a week. Like that, you're likely going to result in having some burnout and some form of injury. So please just always, I tell my patients, just keep in mind that you do need 1 or 2 rest days just to allow your body to recover. And so those are some of the main tips that I normally will share with my patients. Do you guys have any others that you like to highlight with patients?
Well, I totally agree with you in regards to rest and not doing something 7 days a week. I think that's important. Also, I'll often ask patients about their nutrition level, especially in runners and people who are prone to getting stress fractures. If you're not having an adequate amount of calcium and vitamin D in your diet, you make it easier for you become more of a likely candidate for getting a stress fracture or something like that. So just want to emphasize a healthy diet with enough calcium, cheese, the milk, things like that, to make sure you're getting your proper nutrition. So I think that's one thing I'll stress to them as well. What about you, Rich? Dr. Sisson, sorry.
Oh yeah, no, I think I would echo. I think cross training and finding different ways to do lower impact stuff, mixing it in is helpful because it just puts a little bit less stress on your body and gives you some variety. So you're just not doing the same thing all the time. So I think that's one thing that I'd say. I think the other thing is, we're talking about people that are doing overuse or doing too much. That's some subset of people. I think also just when you're choosing an exercise, a lot of people on the other spectrum of this that like it's hard to be motivated to exercise. It's hard to be motivated to be active. I would just put in a plug that when you're choosing something that you want to do to get yourself moving, choose something that's fun or something you like to do. So, as you get older, I'm at work right now. I don't get to go out for recess or play basketball with my friends. You have to choose other activities that incorporate into your life. So finding something you like to do, whether it's like getting out for a walk or doing things, just find some motivation to be active and healthy just at a baseline is good. So we're
Sure.
talking about kind of the other side of people that are doing too much, but there's probably also, I'll put in a plug for people that aren't active just to try to get some activity, find something you like to do.
I think one thing that, you know, a patient can do to kind of keep themselves motivated, but also guard themselves about, doing too much is, use your Fitbit or your Apple Watch. You can set goals on there for how many calories or how many minutes of exercise you're going to do per day. And maybe that's a tool that you can use to kind of keep you engaged, but also keep you like doing on a gradual progression type timeline. Also, a lot of times patients will ask, should I get a personal trainer? And my answer to that is, a personal trainer could be helpful to you in terms of making sure that you're gradually progressing your level of activity. If you are involved in this specific sport, maybe using like your athletic trainer at school can also be useful because they can evaluate your technique and form when you're swinging the bat or the tennis racket or when you're running to make sure that you're using proper technique, and kind of using those resources can also guard you against potential injury in the future.
Yeah, you said too, your apps or your watches, there's all kinds of stuff you can find to do online, but especially, one category of people is like runners or people that are training, not just kids, but somebody might be getting off the couch to try to be more active or try to start doing stuff. So there are a lot of technology that's out there that you can track how many miles am I running a day. And Dr. Gordine, like you said, you don't want to increase too much too fast. So actually using the technology to track how much activity you've been doing is a good thing. And so that's another tool you can use as well.
I would want to say one more thing just to emphasize what Dr. Gordine said about if you do use a trainer, really looking at the form, your throwing mechanics, your running, things like that, I think are really important, because if your form is off, then it's easier to get one of these type of injuries. So I think that is really, really an important thing to look at.
Well,
we have a question. We've got a
yeah,
question
yeah.
from the audience.
Yeah, I saw that.
Somebody's awful.
Yeah, so a question from our audience, it says, it has been documented that elite athletes sometimes present with depression, especially post-college during the recovery period after an injury. If you have a young athlete dealing with an injury that will keep them off the field and away from their team, do you discuss the impact that it can have on mental health with the patients and their parents? Do either of you want to share maybe any experiences that you have with athletes dealing with?
I think that's a really, really good question. A lot of kids, part of their identity is with, or even college athletes, part of their identity is with the sports they play and the friendships that they make, the camaraderie that they have with these teams. So it's taken out a large portion of their daily life when these things happen. So yes, we have talked about that in the office before. And I think sometimes it's not a bad idea, even if they're injured, that they can still stay on the sidelines, or they can be in the training room. So they're still having that contact. Because part of it is social, emotional, to really stay, bonded with your teammates. So I think, working out and still staying involved with the team is a kind of a good way to probably prevent against depression. And also, being open enough to talk about it, because it can be devastating to the psyche.
Yeah, I think definitely, having that discussion with the patient and making them aware that it is common, when you have an injury for you to maybe have some feelings of depression, just kind of introducing that conversation, I think is helpful for young athletes, especially because it gives them the self-awareness as, okay, I'm feeling this way and there's a reason. And, this isn't just an isolated situation that I'm dealing with. Other people have experienced similar emotions. And then, like you said, just finding ways for them to stay engaged in the sport is really important. And they can do that in a number of ways outside of, being on the field.
Yeah, no, I would echo that too. And I think from I was growing up and playing sports to where we are now, I think it's great that over the last year or two, especially that more high profile, high level athletes are actually talking about mental health and wellness and well-being, and talking about how stress and competition affects them, and recovering from injuries. So when you hear Osaka, the tennis players, our gymnasts this past summer, Michael Phelps, the people that talk about their struggles with depression and anxiety around sports or recovering from injury, I think it's good to normalize that it happens and this is part of life, and let them know too that you're there to help them as your doctor. And also, we work for Kaiser, and Kaiser has mental health counseling services that we can refer them to.
Yep.
If you're not a Kaiser patient, you don't have to be embarrassed or afraid to ask if you need help with, mental health and mental well-being. It's wellness and it's health, and it's. I'm glad that people are talking about it more, because people should have access to it when they need it.
Couldn't agree with you more, Dr. Sisson. Another question I think that often comes up is, when kids a lot of times are specializing in sports at very young ages, do you feel like this puts them at risk for overuse injuries?
I think that's a great question, and something we've kind of run into from around the sides here, in the fact that, at least for myself, the people I see in clinic, my own kids, sports now turns into like a year-round thing with whatever your sport's going to be. And there's a lot of pressure on kids or families, especially in areas like we live in, to be in a year-round travel team, or to get to the next level, or to hire a personalized coach so that they can achieve and excel. And everyone's chasing college scholarships and beyond that. And I think there's a point that all of that plays into overuse injuries, that it risks not giving yourself time to rest and heal from overuse injuries, that it also probably plays into some of the mental health aspects that we talk about with anxiety or depression, or we haven't talked about like burnout in kids. And there's a lot of studies that show that people that focus on like a single sport year round are more likely to be predisposed to overuse injuries. If you think about it, doing the same motions over and over, you're more likely to affect all those areas that we talked about, the bones, the growing tissues, the growth plates. There's more likely that you're going to end up having adverse reactions, or just mentally just being burnt out from the sport. And sometimes when I see families, I mentioned Dr. Tassi told me before, sometimes he recommends that families take take a season off from a sport so they're not playing it year round. I often tell people that if you look at high level athletes, so like Patrick Mahomes was a great quarterback in the Kansas City Chiefs. He's phenomenal. You look at him, he played like 3 or 4 sports year round. You see pictures of LeBron or on my social feeds playing football when he was in high school, running people over. So it helps to have different sports, different skills, use your body different ways, so that you don't get the overuse injuries, and you also just don't like burnout or get sick of it at an early age.
I agree completely. I would also say that for some kids who are so focused on one sport and succeeding in it and getting to college or beyond with it, one thing I've noticed is that in addition to overuse injuries, this can lead to other types of injuries at an earlier age. For instance, I'm now starting to see, probably in the last 5-10 years, kids who are teenagers in their late teen years getting Achilles tendon ruptures because they've been playing too many sports or playing one sport too much. Normally, this is not something you're going to see until people are in their 30s or 40s. We're also seeing an increased rate of rotator cuff tears in people in their 30s. This is something you normally shouldn't see until people are in their 50s. So it definitely means that they've been using these muscles or these tendon units too much at an earlier age. So it really has ramifications on your lifestyle, because once you have an injury like that, an Achilles tendon, you rehab from it, there is a chance you may not get back to your pre-injury level of speed or being able to burst or accelerate as fast as you want to. So that is another aspect of this as well.
That's
Dr.
totally. Oh, sorry. I was just going to piggyback on that, which is totally true. Which in baseball players and pitchers, they used to have injuries in their elbow where they would blow out their elbow, maybe in like your 20s or your 30s, and they major league pitchers would get it repaired when they were like 20 or 30 because they used it too much because they're a professional athlete. And you see kids with that same injury now at like 16, 17, or having that surgery before they're even like entering college, if they even get there. Because that's another thing. People might have skill, but if you actually can't survive or you have these overuse injuries, that's another reason that you might not make it to the next level, because you ask your body to do too much too soon at a young age when it's not appropriate.
Yeah.
Sorry, Dr. Gordon, I didn't mean to cut you off.
Oh, no problem. I was just going to ask you, Dr. Sisson, like, what are some of the rehab steps that, a patient should expect if they suffer an overuse injury?
Yeah, it probably depends on what it is, but it's probably some of the same principles that that we've echoed here today, which is kids or adults, if you've overdone something because you've overused it, you need to give your body a break and a rest. So it might be some period where you just have to shut it down or modify or cross train. It might be slowly ramping back up your activity as you tolerate it. You might also be accessing other resources like here. We send people to physical therapy to work on strength and flexibility and core strength. So using other resources like physical therapy and rehab to slowly build things back up after they've injured themselves. Certainly if there's something worse, some of those terrible things we don't want to have happen and you end up needing surgery, that's a whole different course. But oftentimes it's trying to pull back the activity, slowly building it back up and be realistic to give yourself some time to rest and heal.
Would the recovery period or the rehab steps, would they differ at all for your surgery patients, Dr. Tassi?
Good question, Dr. Gordine. Generally, if you've gotten to the point where you need to have surgery for one of these injuries, that means that then some type of structural damage has occurred that can't be reversed with just rest. So the recoveries after surgery can be much longer. So, again, prevention probably is the key, and just recognizing and treating these things early with rest and rehab activity modification is much better way to go than to come to my office, I would say.
Don't see Dr. Tassi.
Yeah,
You don't want to see Dr. Tassi.
No, you don't want to see Dr. Tassi. Yeah.
You want to see Dr. Gordine before you see Dr. Tassi.
Yes.
Yep. Or Dr. Sisson. Exactly.
Yes, indeed.
I think, just like you mentioned, making sure that you're focusing on some of those prevention techniques. And also, I tell my patients all the time, you have to listen to your body. If you're having pain and it's persistent pain, or it's, every time you go to run, you're feeling pain in your lower legs or, etc. Listen to your body, go see your doctor, make sure that things are well before you continue to push yourself. When I played high school sports, my coach used to say, no pain, no gain. But I honestly think that, especially young athletes, you should really be careful with that, because sometimes the pain can be a warning sign that you need to stop and rest and allow your body time to recover, so that you don't end up with an injury that keeps you out of your sport and what you enjoy and love doing every day. So let's see if we have any other questions.
I
don't
think,
see any other questions in the chat. Yeah.
I think you guys, this has been a good discussion. I don't know. I think you've told them everything, Dr. Gordine. So if people want more information, maybe they'll tune in next time. But this was great, and I really appreciate you guys being here. And thanks for letting me be part of this whole thing. This was fun.
Yes, thank you to you both, Dr. Sis and then Dr. Tassi, and thank you to our audience, especially those who submitted questions. To our audience, if you enjoyed this conversation or you found any of the information that we shared helpful, please share the link with your friends and family. Also, we encourage you to follow us on Facebook, Twitter, Instagram, YouTube, or LinkedIn. And also check out our blog at kp.org/doctor for more useful tips and health information.
Okay. And thanks for having me on the panel, Dr. Gordine. I enjoyed it. Enjoyed speaking with you as well, Dr. Sisson.
Thanks, guys.
Thank you.
All right. Bye-bye.